Hello, my name is Alexandra Lapidus, and today I'm going to be performing an enema. So before I even grab my supplies, I'm going to make sure that the doctor ordered the enema, and I'm going to make sure it's the correct type of enema that the doctor has ordered for that patient, since there's different types of enemas. So once I do my checks, I'm going to grab my supplies and perform hand hygiene and put on gloves. So now I have my bag. I'm going to lower the camera so you can see what I'm doing. I'm going to open up the bag. There's a perforated part right here. So now I'm just going to grab my supplies from my bag. The first thing I see is this drape, and we're not in the patient's room yet because we're getting the enema prepared. We're preparing the enema. So I would put this drape underneath the patient to prevent the fluids from wetting the bed. And I'll also provide a bath blanket drape over the patient to provide extra privacy. And I'm going to make sure that the patient has voided beforehand. Okay, so I'm going to just put this aside for right now. Next, I see that we have the Castle soap. If I was doing a soap set enema, I would use this, but since I'm not, I'm just gonna put this to the side. Okay, next I see the bag. So let me just gonna take this out. So next I have the bag, and I'm just going to make sure it has the numbers to the side and it has no holes as well. So now that I inspected it, we're gonna move on to the tubing. I'm gonna make sure there's no kinks or no abnormalities to the tubing, which there isn't. And I'm going to make sure that there is extra lube on this tubing. I'm going to take off the cap as well when it comes to putting it into the patient. And just a little side note, when I insert it, it's going to be 3 to 4 inches inside, so it doesn't squirt, and I'm going to make sure that it goes in through the external and internal anal sphincter. So yeah. Now I'm going to fill the enema bag up with tap water. And this patient was prescribed 250 milliliters of water. I'm also going to make sure that the water is 105 degrees Fahrenheit in temperature. And yes, I'll be right back. Okay, so now I filled up the water, the enema bag of water. And I wanted to mention a few things. I wanted to mention that how I filled it up was by the top of the bag. There's an opening, and then I just put the water, and I made sure it was at the correct degree, which is 105 degrees. Next thing I wanted to mention is I clamped the tubing using the slider clamp before putting in the water to prevent any water from draining before I need it to. And now I'm going to take off the blue cap. And I want to expel air before I administer the enema to the patient. This will just help prevent any discomfort for the patient. So I'm just going to leave the enema bag here for now. I'm going to take off the blue cap. And there is lubricant on the enema already, but just as a reminder, I would put more lubricant on before I administer the enema. So now I have this. I'm going to hold the enema bag at a higher angle. This will just allow the water to drain faster. So the higher the bag, the faster, lower the slower. So now I'm gonna unclamp the tubing. And I'm going to make sure the tube is right there. And I'm just gonna raise the bag a bit. Okay, great. And now I'm going to kink the tubing. So the air has been expelled. And now that I kink the tubing, I'm going to put the enema bag down for a bit. I'm going to bring my sliding clamp right over here. And I'm going to clamp. Sorry, it's a bit... Okay, great. Now I'm going to clamp. Okay, so I'm going to knock, and I'm going to introduce myself. Hello, my name is Alexandra. I will be your student nurse for today. Can I see your armband for safety, please? What is your name? Okay. And what is your date of birth? Are you allergic to anything? Because I see you don't have any allergy bracelets on. No. And you don't have any. You're not a fall risk. Which is wonderful. Today I'm going to be administering an enema that your doctor had prescribed for you. Is that okay? Okay, great. This will take about 10 to 15 minutes. Okay. So now that I've introduced myself, I'm going to make sure that I wash my hands and provided privacy as well. The patient's gonna be in a sideline position, and I also put the bath blanket over the patient as well. And the patient already knew about the voiding situation prior. So normally I would hang the bag on the IV pole 12 to 18 inches above the anus. In this case, we don't have an IV pole, so that will not be happening. I'll be using my hands. Let me just bring this down so you can see the whole situation that's happening. So the first thing I'm going to do is I was going to hold it up, which I told you that. The next thing I wanted to inform you is I put lubricant on the tube, extra lubricant because it already comes. And then I'm going to pick up the tip and about 3 to 4 inches with lube on it. And I'm going to place the bag right here. I'm going to spread the buttocks, and I'm just going to tell the patient what I'm doing so they're not concerned. So let me just spread the buttocks, and I'm going to insert the tube. I'm going to insert it 3 to 4 inches. Okay, and I'm going to make sure that my fingers are against the rectum to ensure that it went in fully. So next I'm going to change my hands and open up the slide clamp. So I'm just going to put my hand here, and I'm going to open it up. One sec. Just like that. I'm also going to kink the tubing just in case, to relieve any pressure by not allowing the water to go in fast. So next I'm going to use this hand to lift up the enema bag because we don't have an IV pole. So now I'm going to lift this enema bag up, and I have the tubing kinked for right now. And then I'm just going to release, then kink, release, then kink, because I don't want it to go in too fast to cause the patient discomfort. Then kink, release, then kink. And I'm going to do this repeatedly until I'm done with the enema. Kink. And while this procedure is happening, I'm going to ask the patient, are you doing okay? Okay, great. I'm going to remind the patient to take deep breaths to help with discomfort. And release, then kink. Okay, the enema is almost finished. Release, then kink. Release, then kink. Sorry, just going to make sure that it all goes through. Okay, great. So next I'm going to put the enema bag down, kink the tubing, and then I'm going to grab the buttocks, take out the enema slowly, not at too fast of a pace. And okay, now that I've kinked the tubing, I'm going to close the buttocks. Now I'm just going to use the slide clamp, and I'm going to cap the tubing. I'm going to give the patient a bedpan or a toilet, and if they use the toilet, they're not going. I'm going to instruct them not to flush. I'm going to observe the color and consistency of the stool, put the environment back to place, make sure the patient's comfortable. I'm also going to inform the patient that I will be back to check up on them and that the procedure went wonderfully. And yeah, I'm going to document that I administered the enema and gather my supply.